What really brought this to light is that one of the nurses who worked at the outpatient surgical center had a son who was in recovery for an opioid addiction, and she really was the first one to really drive this to everybody. He first got started after a sports injury, and really she blamed a lot of that on him having access to more pills than he needed.
I asked the prescribers, because we work as a team, and usually the PAs or the residents, why they gave so many of the pain medication. And they said, well, they were taught at some point that in order to keep the requests for refills on weekends down, that they were advised to prescribe large numbers of opioids.
Sadly, we're 5% of the world's population, and we use like 90% of the opiate pain medications.
I unfortunately am somewhat embarrassed to admit, as a police officer, I look at heroin as something that bad people did, that people who were so far gone, that criminals did. Now I see it as, it could be anyone's child doing it now.
A few years ago, in early 2014, one of the nurses, Leslie Stenbeck, and I were talking, and at that time there were a couple of athletes in Scituate who were in some difficulties with drug use, and one of them actually died of an overdose. So this was a pretty, apparent and visible thing that happened in our town, and sort of sparked some conversation. In this conversation, we jumped off and formed a committee. First thing we did was actually do a study. We found a great deal of variation amongst the orthopedic surgeons. So basically through that process we kind of came up with these three initiatives. One was obviously to reduce the number of pills, and the physicians agreed on a standard number. The other was that we would prescribe one type of medication, a pure pain medication without a combination. The last thing we did was to prescribe the narcotics on the day of surgery.
HPSO kicked off the Opioid Task Force group that is meeting currently to teach specialties across the system that prescribe narcotics.
Just trying to figure out how to consistently get it to the patients.
About the work that the orthopedists had done in standardizing what they do, the number of pills they prescribe. Immediately, several groups joined, all of whom have developed standards for their most common procedures. Within 3 months of that work starting, the number of pills going out post-procedure have decreased across those specialties from anywhere from 20% to 50%.
We looked at our practice and said, geez, for a lymph node biopsy, I was telling the patients to, don't fill this unless you need it, but I was giving 20 tablets. When we looked across our group, some of my partners were given none, others were giving more than 20, and we started stepping back and saying, well, what happens if we go with what he's given and give none and see what happens? So far in the last 6 months, I've not been given 20 tablets, I've been given none, and I can't think of one patient that's called with more pain complaints.
I started asking my patients after procedures how many they actually took. And the number was usually someplace between 0 and 5. And with the new opioid crisis and the attention on the availability of opioids and limiting that availability, a good place to start would be in the number of opioids that we prescribe for our patients.
Patients are very surprised how much they don't need. They can have a prescription of 30 and only take 3 or 4, and they're actually tell you at their post-op visits that they were surprised how well they did, that they were quote-unquote expecting more pain.
We started to look for other ways to help patients without recommending or prescribing opioid medication.
It's appropriate to explore all other options, exercise and stretches and ice and heat and acupuncture and meditation, which has been shown to be very effective as well.
We have to start telling people they're not going to be pain-free, which is a new idea for people having surgery. In the past, we've been told by some of our regulatory agencies patients should expect to be pain-free. You're not going to be pain-free after surgery. We need to make you comfortable enough to carry on with your activities of daily living.
About 70% of people who abuse medications get it from a family member or friend with or without them knowing. So that's the other idea, is to get it out of the cabinets.
If they're there and they're sitting in the medicine cabinet, they're not going to be used, bring them to the police station, no questions asked, you just drop them in the box and leave. It's that simple.
Not only are we educating patients about this, we're also trying to educate other practitioners that there are other ways to think about and manage chronic pain.
I do think there's been a bit of an ignorance as to the amount of narcotics that have been prescribed for procedures and the amount of narcotics that have actually being utilized.
The PMP is the prescription monitoring program that's been set up by the state so that we can track controlled substance prescriptions that patients are receiving. So we can see how many providers they've received prescriptions for, what types of prescriptions they've received already, and it helps us to do a better job of decreasing the amount of medications going out into the community.
We have to change, and it's hard, but this is the most important issue that we're facing.
It's also important to think of these people as people, not the way people thought about quote-unquote drug addicts 15 or 20 years ago, but these are real people. I had a cousin of mine pass away, and you know, like most patients or people, friends, family who have this issue, it's kept underground. But she was probably 18 when she started using, and she died shortly after she turned 20.
We've got a lot of work to do in all aspects. All of society needs to change how we look at this issue. Patients need to understand that we do care about their pain and that we want to help manage their pain, but we have to find safe ways to do it.
I've learned a couple of things. One, we were prescribing a lot more than we needed to be prescribing. That was apparent very early on. And the other thing is the sort of burning platform that this represents. The way specialties across the medical staff have jumped onto this task force to do this work has really surprised me as well. So everybody understands what a crisis we're in now and wants to do the right thing to do what we can to address that.
If you'd like more information on this project, please contact the Health Provider Services Organization at HPSO at sshosp.org. Thank you.